Hi there. Thank you so much for joining us today for this open day for the postgrad online programme that is the Masters in Infant Mental Health. It's really great that you were able to join us for this session. I am just going to introduce myself and then I'll share with you our plans for the session and introduce you to one of our students who's going to be joining me for the session as well. So my name is Dr. Fiona Sim. I am one of the two programme directors for the online infant mental health masters here at the University of Glasgow. Now, in this session, we are going to cover first of all, introductions, and then we're going to think about looking at a wee overview of the Masters programme. We're going to think about why the University of Glasgow is such a good host for this programme. We'll think about the endorsements that we've had for the programme so far and look at the structure, what's going to be covered in the Masters, and just share with you some of our learning as we've been going through this journey. We'll also share from one of our students who's joining me today. I'll introduce her in a moment, and then I'll talk you through some of the sort of practical administrative elements in terms of getting entry to the programme, career prospects, student support, and the application process too. And I'll then share with you a demonstration of the learning platform that we use so that you can get a sense for how the learning is presented each week and how you'll be able to access that and what that'll look and feel like. And then we'll have some space where we can answer any questions that you've got. So please feel free to post questions in the chat as we are going along on this session. Just pop your question in at any point. I've got the chat beside me, so I'll either pause while I'm talking or we'll just save your questions to the end, and we'll have some time there to answer questions. Just a wee note as well, you're all going to be on mute, so if you do have any questions, just pop them in the chat, okay? Or wait till the question and answer session at the end. So I'll just introduce to you Angelica, who is joining me. Angelica, if you're happy to just pop on your video just now so that we can all see you. Angelica is one of my second year master's students, and she is going to be just sharing with you some of our experiences on the master's programme. So, Angelica, are you happy to introduce yourself and just say a wee bit about what you do, and then you can share more at a later stage?
Yeah, sure. Hello, everyone. I'm Angelica. I live in Cyprus, and I've been working with parents and babies since 2019. And yeah, the program has given me a very big a big base of knowledge in regards to sorry, my English is not my first language, so please excuse me. In how I support the parents and the families that I work with. So yeah,
That's
that's
perfect, Angelica. Yeah. We'll maybe talk a wee bit more about your experiences of, studying alongside working and how you're managing that balance later on. But it's really helpful to just have you introduce yourself. And Angelica has many different hats that she wears while she's studying. So I'm sure a lot of you who are joining us today, either currently or watching this online later, will really be able to relate to the complexity of trying to balance work, studies, personal commitments, um, and trying to just constantly hold that juggle. It is not easy, but I'm sure Angelica will be able to share with you some of her insights about how she's managed that later on. So the programme team consists of myself and another Fiona as the programme directors, and we lead a lot of the courses, so you'll get to see our faces a lot throughout your studies. We also have Melissa Scott, who's our fantastic administrator, and Ryan Norrie, who's our learning technology advisor. So between the two of them, they are your go-to person if you have any questions about anything to do with your applications or any sort of administrative issues while you progress through the Masters. Melissa will be on hand. And similarly, Ryan, for any sort of technological questions, he is the one who builds all of our learning content for us. And I'll show you what that looks like later. It's really lovely. And he's just fab. If there are ever any technical issues, he'll be on hand for you. We also have Jason Lang and Seanad Clear as two of our other course leads. Now, they are both active researchers in the University of Glasgow, and they bring all of their amazing research knowledge into teaching. Jason teaches the infant mental health and neurodevelopment course, and Seanad teaches a research methods course. Now, it might be helpful to just begin thinking about what is infant mental health. So often I get asked if what I do is research depressed babies. That's not what I do. And we all know and are learning more and more about just how holistic the term infant mental health really is. 0 to 3 came up with this really lovely definition of the infant's growing ability to form secure and close relationships, to experience and express a wide range of emotions, and to engage with their surroundings. So it's really about all of the various layers in which the infant learns from their environment and influences their environment. And we really take quite a holistic bioecological view in terms of infant mental health and infant development. We're really influenced by Yuri Bronfenbrenner and his model, which looks at the various nested concentric layers, almost like an onion, thinking about all of the layers on the infant as they grow and how the infant then influences those layers too. So we think about the infant and then we move slightly further out and we think about their context, their immediate family environment. Then we think about their learning environment, their educational environment, health environments. And then we move further out to consider their neighbourhood, and then further out again to consider the sort of more macro influences. So those are things like political choices and global events and influences that shape the child indirectly without them necessarily even realizing it, but all have an important interplay on the child as they develop. So the University of Glasgow is uniquely positioned to host this infant mental health masters. The masters sits within the School of Health and Wellbeing and is aligned with the Centre for Developmental Adversity and Resilience. Now, the CEDAR team has 3 key research themes. So these are infant mental health, neurodiversity, and complex mental health presentations. So they look at things like the overlap between neurodiversity and maltreatment. And the researchers from within that team feed into the content that you're going to be learning and engaging with. And they feed into the policies, the examples that I've shared here are some of our recent press releases from the CEDAR team research. The research that the team conduct really has a very significant influence, and all of this will shape the learning that you're receiving. So the content within the course is very research led and is very current. We keep up to date with all of the political and research and clinical changes that are constantly happening within this sphere, because infant mental health is such a new discipline and we are constantly readapting and learning and reshaping what we know and how we teach in this field. So it's a really exciting field to be in, and I hope that you will enjoy studying it. So the Infant Mental Health Masters Programme is now in its 2nd year of running. We've received really positive feedback from our students and from our external examiners. It's a really unique programme. There is only one infant mental health MSc programme in the UK and only a handful internationally. Our programme has also been endorsed by the Association for Infant Mental Health UK. So the Infant Mental Health UK have shared the following text here. They say that they are really pleased to confirm that we've utilised their infant mental health competency framework. Now, this is really significant for you as a student because as you move through the master's programme, you become able to evidence how you have achieved the Association for Infant Mental Health UK's clinical competencies. So we have aligned each of our intended learning outcomes across the programme with the competencies for the Association for Infant Mental Health UK. And by the end, you'll have a portfolio which demonstrates your competency, which you can then share with future employers or current employers in alignment with your career and development goals. So we are really keen that we align ourselves with organisations that are practicing best practice within the field. Now, just another wee note, the way that we run this programme, we have developed it in a really collaborative manner. So as we've been building our content, we have engaged the expertise of clinical team leads within infant mental health. We have engaged the expertise of those working for the Scottish Government who are influencing infant mental health policies, those working in third sector organisations and charities, and those working within education as well. So all of the teaching attempts to form as holistic a remit as possible because that is the reality of the infant. You know, they take from all of these various sources, and we want to reflect that in the teaching that we offer you as well. And we really love that that is reflected in our student population too. We have a really broad range of students, and I'll share a wee bit more about that with you later on. Now, our student feedback so far has been really positive. Here's some quotes from students. Generally, the content is really positively received by the students, and the online learning platforms seem to be really user-friendly and accessible. I'll demonstrate them later on. There seems to be a high level of relevance to various roles. So there's an example of an assistant psychologist given here, and a health visitor as well. A midwife and health visitor has shared here too. And all of the feedback that we've had so far has been incredibly positive, and we also actively hear from our student body so that we can shape our practice. And there have been changes made to the programme, to the content, and also to the courses that we deliver based on student feedback as we're going along. So it's a very iterative approach. Since this is a new master's, we are really keen to learn from our students and respond to their feedback. So this is the structure of the master's programme. You'll see that the year is broken up into 3 semesters. These 3 semesters run September to December, January to March, and then April to July. So in your first semester, you do 2 5-week courses, and those cover the really sort of foundational theoretical topics within infant mental health. And then in second semester, you go on to study infant mental health and neurodevelopment in practice, which is led by our psychiatrist and lecturer, Jason Lang. And then in semester 3, we learn about the systems around the infant, and that's led by Fiona Turner. And that looks at all of the various sort of health, education, child protection systems that are around the infant as they grow. So that first year is all about theory building. And then in year 2, we go on to build skills. So we look at infant observation and reflective practice in this first semester of year 2. And those are really foundational skills for any sort of practice within the sphere of infant mental health. We want to develop our students to be able to observe the infant and to really notice what's going on for that child, what's going on with the parent and their dynamics as a dyad, and what are the areas that we can work on to offer support. And then we really want to develop reflective practitioners too. So we have a clinical psychologist who comes and joins our team for that course, and she offers reflective supervision sessions for the students. And these sessions have been really well received. The students seem to have really enjoyed them. And basically, that just teaches you how to apply these reflective principles in whatever context you find yourselves in. And then we study applied research methods. And then in semester 3, we study clinical skills in infant mental health. And that course is really quite unique in that it offers your taught content, but then it also offers you the opportunity to be trained in an intervention of your choosing. And you can choose from Circle of Security, Video Interaction Guidance, the Neonatal Behavioural Observation Scale, MELO, Watch, Wait, Wonder, or Solihull. And you are signed up to attend one of these training sessions online. All of this is online. And that comprises 2 weeks of your 10-week teaching for that session. So it's a really interesting course, and our second year students, including Angelica, are currently studying that at the moment. Then in year 3, we have 2 options. So students can either choose to complete an infant mental health research dissertation, in which you'll be assigned a supervisor and you'll be able to choose a dissertation. You can choose to do a systematic review if that interests you, or a scoping review, or you can choose to do a service evaluation. Our students this year have the opportunity to collect data from some of the clinical teams working within Scotland and use some of their routine data to analyse that and explore how the services are functioning, to really robustly evaluate them, which provides an excellent opportunity to do some really practical and impactful research, both for the students and for the services here in Scotland. We then, as another option, have an infant mental health placement, or internship. If you're based in Scotland, we can facilitate that. We can find a team for you to work within for around sort of 10 weeks of various sort of different hours. It can be quite flexible across the year because you have a whole year to complete the placement. And then based on your experience within the placement, you complete a portfolio which has sort of reflective writing. It has reports from your supervisor. So we'll ensure that you have appropriate supervision for that as well. If you are an international student and you wish to secure your own placement overseas, we can facilitate that too. We just need you to find the host for your placement, and then we can engage with your host to ensure that your supervision is appropriate as well. And we'll keep, you'll have a university supervisor throughout your experience in that final year as well. So the master's runs over 3 years, and it is a part-time master's, so you can work alongside it. And you can exit the programme at any of these 3 points. So if you study the postgrad certificate and that feels like enough for your career pathway, you can exit with a PG cert after 1 year. If you're interested in staying on to do the postgrad diploma, you add another year in. And then if you're interested to carry on for the master's programme, then you study for the full 3 years. You're very welcome to join the programme in year 1 and change your pathway as you go through. So if you had signed up for the master's originally, but you realise that actually the workload is just too heavy, you can drop out after year 1 and complete your postgrad certificate, and you'll still have that qualification. So it is a very flexible programme designed to work alongside you and your commitments. And all of the learning content is fully online. So we host 2 drop-in sessions, which are live online, basically like this sort of format on Zoom or Teams. And those drop-in sessions are in alignment with your assessments. And so it's just a chance for us to get together as a learning community and discuss your assignments that are coming up and catch up with each other as well. But all of the rest of your learning content is online for you to access whenever you need to access it around your other commitments. Now, I'm going to hand over to Angelica, And you'll see on the slide there is a picture, a little snapshot of our cohort at the moment. So there are many countries represented within our cohort and many different disciplines as well. And Angelica's just going to share a wee bit about her experiences of studying within the programme. Thanks, Angelica.
Thank you, Fiona. So, my experience, I have to admit that my experience has been better than I expected. I initially felt quite stressed because I wasn't sure whether I could. I had studied in the past many years ago, and I wasn't sure whether I could jump back in and complete a master's degree. So, once we started, I felt more confident in my ability to manage the workload and engage with the material. The content has been very interesting, very relevant to my practice, strongly evidence-based, which I really value. It's clear that a lot of thought and collaboration from different experts has gone into this program, and I feel that that adds a lot of depth in the quality of the program. So I've been also very pleasantly surprised with the University of Glasgow because they offer a lot of flexibility and willingness to go beyond what was initially outlined. I have also found myself quite invested in the program, and I'm starting to feeling a bit weird now that I feel that it's coming to an end soon. So I've really bonded with everyone in the course. Yesterday, I've completed my intervention training in NBO, in newborn behavior observation, which I found particularly valuable and insightful. Very blessed to have been able to go through the training. Yeah.
That's brilliant, Angelica. I really want to chat to you about that later on and find out how you go on. Um, is there anything else, I wonder, that might be helpful for students to hear from you? How have you managed so I can't remember if you shared exactly all of the different roles that you perform. So it might be helpful for our students to hear what you do.
Yes, sure. So, first of all, I am a mother of two. And I'm a single mother of two, which I have the most. I mean, I'm mostly the sole I have the sole custody. So I have two children, which I wanted to be a full-time mom, which means that I'm doing as much as I can to be with them. When they're not at school. So my priority was my family and is my family. And then I have my own work, which has to go well because I need to provide for my two children. And I decided that this master's would help me build on my professional work. And while I started, because I was afraid at the beginning to start, because I didn't know I had so many things going on. Once I started, I realized how passionate I was about it. And after doing some research, I realized that in order for me to apply it here in Cyprus, I needed to have another title. So I've also, since September this year, I've also applied. I'm also doing a bachelor's degree in psychology in online from a university here in Cyprus. So I've been doing both simultaneously and being a mom and having my own work, which when you have your own work, you're not just doing the service that you provide, you're the cleaner, you're the secretary, you're everything. So time management is essential, and I really don't have time to procrastinate, to be honest. So,
Yeah, that's amazing. And I think it'll be really inspirational for a lot of those that are listening to this, Angelica, because most of our students will be at a stage in life where they have other responsibilities. They'll already have careers. They'll maybe have families or parents or others who are dependent on them to care for them. How do you fit in your studies? When do you do it? Is it an evening thing, a weekend thing?
It has to be when it's mostly weekends, and it's mostly the weekends that I don't have the children. But I also, because it's my because the appointments that I do at work, they're in the evenings, so I have some time in the mornings to study. If it's an emergency, if let's say we have an assignment, I do study on the weekdays in the mornings. So anytime I find, because the material is so interesting, for me, it felt that I couldn't drop, I mean, I couldn't leave it down. I wanted to read. So it's either in the morning, in the evening, whenever I have a free time, whenever I'm taking my children to activities and I have to wait in the car, I'm with my laptop and I'm studying.
That's brilliant. And do you find that the learning materials are accessible enough for you? So there's an alternative format that you can download, isn't there? So if you've not got internet access, you can access the PDFs wherever you are.
Yes, exactly. I actually have internet on my phone, and I connect the phone on my laptop. So I use the learn I use Moodle, but I do, because I do download the alternative the PDFs, because I feel that that's a more organized way for me to study if I need to do some revision. That's how I do my revision.
Okay. And when it comes to assignment times, do you find that your level of study time has to increase significantly, or is it sort of spread out throughout the semester?
It doesn't really have to increase, but in order for it not to have to increase right before the assignment, I needed, and I learned that along the way. I needed to be better at time management. So I had to be more organized, so that, because I was anticipating an assignment, while where at the beginning, when I was learning, when I just started, I was learning, and maybe at the very first assignments, I was a bit, felt a bit too much,
Yeah.
the work. But as you learn, as you go through the course, it gets easier.
Okay, that's really helpful. Thanks so much, Angelica. I'm just going to carry on with a couple more slides to talk about some of the administrative elements of the programme. But if you have any questions that you'd like to ask Angelica as a current student, please pop them in the chat and we'll have some space at the end to discuss those. So the entry requirements for this master's programme are a 2-1 honours degree, or whatever the equivalent is in your own context, in psychology, nursing, medicine, education, social work, midwifery, health visiting and childhood practice. We may sometimes accept degrees at ordinary or non-UK equivalents, and we might also accept applicants with significant relevant work experience in addition to lower qualifications. So basically, the take-home message is, we have these entry requirements, but if you are interested in studying the master's programme and if you're motivated, please just send us an email and we may be able to accept you on the course if there are relevant work experiences, or if you have other degrees within a totally different subject, but then your work life has taken a different path to perhaps what you anticipated and is more in line with what we're studying. Just please get in touch, because we really want a diverse cohort studying with us so that we can learn from you as much as you are learning from the master's programme. The career prospects from this programme, as you've heard from Angelica, it can really support private practice in whatever capacity that is, in supporting infant mental health and well-being, and family mental health and well-being in the early years. It's designed specifically to equip learners with skills to progress within psychology, psychiatry, infant mental health, medical professionals, social workers, midwives, health visitors, paediatricians, third sector, infant support, education. Essentially, we know how broad the field is, and we have tried to create a programme which equips you within whatever sphere you're in, holding the infant and their caregiver in the early years. And completion of the study grants potential for further academic study, promotion, increased earning potential, and new alternative career paths. Now, there's lots of support available at the University of Glasgow. We have a student support officer who's on hand for you. You can email them at any time of day. That's Maurice. and he will get in touch with you within his working hours and let you know when he can set up a meeting, and you can have a chat with him and catch up about any sort of support issues that you might have. We have a disability service and a career service, which you're really free to access. Um, we, as Angelica said, we really want to enable you to complete your learning in as supportive an environment as possible. So if there's anything that impacts on your ability to complete your studies, if you have any disabilities or any caring responsibilities, we really want to make your studies work for you. And so we can be flexible with you and around your needs and your learning preferences too. So the applications are accepted right up until the start of semester one, which is in September. Well, the date is 2025 on that slide. Sorry, that should be 2026. We recommend applying sooner so that it's not a last minute rush to get all your paperwork through, but we will accept applications right up until semester one. You can find any information that you need on our programme page. So you'll find that at glasgow.at.uk and just search infant mental health. If you have any questions about applications, then the email address is on the screen there, and I'll pop it up at the end again, and you'll find the admissions inquiry form on the link there. The key facts in terms of the master's programme, the duration is 3 to 6 years. We usually have 20 hours. So for a 10 credit course, we say that you would roughly spend around 10 hours per week studying. So it's 100 notional learning hours. So that's roughly 10 hours a week. But obviously that will fluctuate depending on assignments and whatever else is going on. So the learning content each week really doesn't take too long to access. It's maybe a couple of hours to read the learning content each week. And then you have a reading list that you can access and work through, and assignments to work through as well. So that all will add up to an average of 10 hours per week for a 10 credit course, or 20 hours per week for a 20 credit course. We have study breaks 1 week every 5 weeks. So, and then holidays as well. So you'll only ever do a sort of 5 week block in a winter, and then you'll get a wee breather for a week, and then you'll start your next 5 week block. The cost is £15,000, and there are some discounts available. So please get in touch. If you are an NHS student, for example, you'll get a discount on your costs as well. The course starts in September, and the study mode is fully online. Now, I have an example here of what the learning content looks like. It might be quite helpful for you to see. So we host it on Moodle, and you'll see from the start, you'll have all of your weeks that you can just go in and click on each week of content, and you just scroll down and you can find all of your key information. You'll get your dates for your drop-in sessions and your assessment information. It's all hosted on the Moodle page. Now, your assignments, there are always 2 assignments per course, and we try and weight them usually sort of 70-30% or 40-60%, so that if you have one assignment that's a wee bit trickier, it's not 100% of your grade based on one assignment. Each week of learning content looks like this. You go onto the week and you just click on the link, and that pops up then with the learning content, and it's split up into written content and videos. And we also have little sort of interactive activities for you to complete. Every week also has a quiz at the end of each week, where you get the opportunity to consolidate your learning from that week. Now, this is just a wee example of what a week of learning content looks like. Now, when I talk about a week, that's basically just one week. It's one sort of, you click the link. You can tell this is why Ryan is the tech person. I don't even know the word for it. You click the link for a SCORM package, they call it, I think. And that's your week's teaching. So it's one click, and that's all of your week's teaching on one page. And you just scroll down and you do your readings and watch any videos that you have and you'll be able to access that. And we also invite specialists in, and we film them talking about different subjects. And we sometimes include YouTube videos as well, just to bring in lots of different influences in your learning. We then present case studies as well to bring your learning to life, and to really help you apply the theoretical content with real life settings. We, let me just go back. So that's what your Moodle looks like there. So you have all your courses on your page, and you'll be able to just access it whenever you need to, whether it's in your car waiting for your children to come out of their clubs like Angelica, or sitting at a desk. It's completely flexible. And the aim is that it fits around your life and all of your commitments. If you have any questions, please feel free to email the program mailbox. The contact details are there. And you can also just contact myself or Fiona Turner directly. If you have any questions that you'd like to ask us, then please don't hesitate to get in touch. Now, we have some time left over now where we can answer some questions. So please, if you have any questions that you'd like to ask, you can either unmute yourself or pop some questions in the chat. We have some questions that have come up in previous open day events that we can cover. So I'll maybe just start, Angelica, with you, if that's okay. We've had a bit of a chat about how you manage your time commitments with your study and your work, but I wonder if you would be able to answer how you believe this program might help you progress within your career.
Well, I think I'm already applying it in my work, which this is the for me this is a very it's an extraordinary thing that I actually feel confident to apply and use the knowledge and the tools that I've learned. So because here in Cyprus the system is different. There's a lot of we are a bit behind in terms of the of infant mental health. So we're anticipating a change in the next 10 years. So it's a long way to go. So I'm feeling that I could be helping, initiating something in regards to infant mental health here. So yeah, I'm hoping that this answers the question, Fiona.
Yeah, no, that's great. I think it's something that probably that a lot of our international students will be able to relate to as well, because the field is so new, and Scotland has been sort of leading the field a lot in our application of infant mental health support, in that we have sort of multidisciplinary infant mental health teams set up now. And so we're in a really good position to be able to share that learning now internationally, which is super. But I imagine there will be a lot of students from a lot of different areas of the world where infant mental health practice just isn't happening, and any support is given through, pediatrics or potentially midwives if they have the capacity, but there's just always that issue of capacity and caseload. So I think that's really helpful to hear your perspective. We've had a wee question on the chat as well, asking if there are any resources that we would recommend students look at before starting the course. So there's no prescribed reading that you have to do before coming on the course. We provide you with all of the content that you're going to need, and with a reading list that you can access. If you are really keen to learn a wee bit more about the field before you join us, there's an excellent handbook, the Handbook of Infant Mental Health by Charles Zena and colleagues, that you can buy yourself if you are interested. It's a really comprehensive textbook, and probably the only one that I would recommend before you start the program if you're interested. But as I say, we provide you with all that you are going to need for your studies. So another question that we are asked about is community, Angelica, and maybe you can touch on this a wee bit. So this is something that is tricky with online learning. It's hard to build a sense of community within your learning cohort. How are you finding that? And feel free to be honest, Angelica, because we're still learning how to support you well to do it as well.
So in regards to community, it's an online program, and I feel before starting, I felt that I was going to be away. I mean, far away from the base, but it doesn't feel that way because the teaching. I mean, the Fiona and the rest of the team is always there. Actually, there is an instant response whenever we have an issue or even a thought, let's say, that comes up. I mean, they're there. So I actually feel that we're actually neighbors and not far away from each other. And it's not nice to compare, but because I'm doing another course here as well, which is in Cyprus, which is like a 10-minute ride from home, it doesn't feel as close, the community, as it does at the University of Glasgow. And that's honestly my honest answer. So, and in terms with the rest of the colleagues, we do a specific module actually did help bring us even closer, which was the reflective practice module. So we actually had a good chance to listen to each other more. We had more calls during the month, the 3 months that the term. So yeah, it's really, you do feel the community. You feel part of the community.
That's great, Angelica. Thanks. That's good to hear. We really try and maintain a visible presence online. So if you, as Angelica said, if you have any questions that pop up or thoughts, we really value you just sending us a quick message either by email or on Microsoft Teams. So every class, we have a class space on Microsoft Teams where you can post your reflections on learning, and we always read those and try and respond quickly to them as well, so that we are all part of the same learning community and all sharing our thoughts at the same time as we progress through the learning content. One last question for you, Angelica, that was brought up previously. What do you wish you knew before starting?
I don't have an answer to this. I was very happy to not know anything and go in like a blank canvas. So I just, yeah, it was good that I didn't have any either expectations or anything. It actually surprised me that there were so many things to learn, and yeah.
Great, thank you. So we've got a few other questions that have come up that I will be able to just speak to just now for the last sort of 10 minutes or so. We have a question around the tuition payments and whether there's an option to pay in installments. So tuition fees must be paid by the end of the academic year. Otherwise, you won't be able to graduate or register for the next academic year. You can pay using a really wide variety of methods, including installments. And if you want any further information on that, please just email the course inbox that I've shared there, and Melissa will get back to you with all of the details that you need. But as with your learning, we really try and be as flexible as possible to support you accessing this teaching. We're also often asked if online students are able to graduate in person at the University of Glasgow, and we would really love for you to graduate in person. As the programme team, it's so lovely to get to know each of our students as they grow throughout the master's programme, and we really love getting to engage with our cohort. And so for us to be able to celebrate their graduation day in person would be just absolutely fantastic. So if you're able at all to make it to Glasgow for graduation, then there will be a robe waiting for you, and we will gladly welcome you. If not, you're able to graduate in absentia, and you'll still get your certificate posted out to you, and it won't make any difference, obviously, to your qualification at all. So we also have some questions about further research post-masters. So for students who are interested in studying PhDs, we, as I mentioned, we're aligned with the Centre for Developmental Adversity and Resilience, and there are a lot of active researchers within that team in the field of infant mental health. And so there's always opportunities for further study. The main sort of issues are usually around funding, but if you can find a funder, and we'll be able to point you in the direction for funding bodies as well. But there's always the opportunity for further study if you're interested in doing PhDs at the University of Glasgow. We also have questions around deadlines for accepting offers. So you've got 4 weeks to accept an unconditional offer. If your offer is conditional, you must accept the offer and meet all conditions before this will be updated to unconditional. And another question about enrolment. So registration and enrolment opens in mid-August 2026. And students will normally receive an email a few days before, which will welcome them to the programme and provide more detail on how to register and enrol. And after you've completed that, we'll have an online induction event, much like this one, but we'll go into a lot more detail about the practicalities of completing the learning for the programme, and we'll talk about a calendar of deadlines throughout the programme as well. We have another question about assessment methods. So someone's asked about assessment methods for the different courses. Now, we are a lot of us psychologists, and so we appreciate that there are different learning styles. And so we've really tried to adapt our assessment methods to support different learning styles and also to support you in your professional life. So we have options like developing infographics or doing recorded PowerPoint presentations. We use case studies a lot. So we present you a case study and get you to analyse and respond to the case study either in writing or through recorded presentation. We have, you can do podcasts as assignments as well. We also have the opportunity to, in the observation course, we get you to watch some videos and decode those and share your responses to those observations with us. Angelica, have I missed out any forms of assessment that we use? We have some written assessments as well, all reflective pieces too.
Mhm. I think that's all. And
Yeah.
really good that we had the opportunity to learn how to do different styles of assignments.
Great. Yeah, we really want to equip you. We want this course to, yes, build your knowledge and your skills and your theories, but we also want it to be really applicable to a work context. So we want to develop skills in you that you're going to keep using throughout your work life, whether that be presentation skills or written skills. We really want to develop those skills within each of our graduates. Um, there's a question around how many courses you can take per semester, and what options there are in that. So each semester is 10 weeks long, and you will either complete 2 5-week courses or one 10-week course for each semester. Now, all of our courses are core, which means you can't choose which courses you take. So each semester it's prescribed what you have to take. Now, we've thought really long and hard about that, and we believe that the courses that we offer you give you the most broad range of knowledge and skills that you will need to work within any sort of sphere. So that's why we've made them all core, because we think they are all really fundamental to your practice. And then when it gets to your final year, obviously you have the option of completing the work placement with portfolio or completing the research dissertation. Um, and that's really to sort of tailor more to your needs within your workplace as well. And as I said before, the research dissertation, whilst it is an academic piece of work, we also will really try our best to provide you with the opportunity to conduct a clinically based research dissertations. So the students this year, as I mentioned, are going to be able to do service evaluations if they're interested in studying those, where their research is really clinically relevant and is based on data that's gathered within clinical practice. So as much as it might be an academic exercise, it's also really rooted in applied practice. So there's another question around accessing the University of Glasgow campus and the library facilities. So we give all our students a student card, and that allows you to access the library and other areas on campus. You must complete an academic registration and have uploaded a passport photograph to your student record to get a card. And the card will be posted to your home. And when you have that card, you can come and access the campus at any point that you wish. You can study in the library, you can access it the same as an on-campus master's student would. And in terms of your access to educational and career resources as an online student, you'll have the same breadth of opportunity to engage with career services as on-campus students. So a lot of you'll be able to access career services and disability services online and have online appointments. And we'll also have online events for sort of online postgraduate students, such as this one. And there'll be another one later on in the year as well, where we'll talk about online study at the University of Glasgow. I think that probably covers most of our questions at the moment. We don't have, there's a question around when the exam period is. We don't have any set exam period. We just do continuous assessment throughout each semester. So I mentioned previously that each course has 2 assessments. It's best practice not to give you one assessment for an assignment because that helps you spread your study load more effectively, and it puts less pressure on you to perform at your best performance on one exam. So we really try and make the study methods as supportive as we possibly can. And I think that's really one of the key sort of take home messages that I would like you to go away with, that we really want to be able to support your study at the University of Glasgow. We think that this programme is really innovative and pioneering, and we would really love for you to be able to come and engage with it, and that it would be supportive of the context that you find yourselves working in. So if you are in education or third sector or charity or clinical practice or healthcare, whatever area of life you find yourselves in where you are supporting infants and the early years, their well-being, their development, then we believe that this master's programme would be really well suited to you. And we will do our absolute best to support you through your studies. So if you are interested, please do get in touch with us on the email address that I've provided. And thank you so much for your time today. Thank you, Angelica. It was really lovely to see you, and we really appreciated learning from your experiences. And thank you to those who have joined us live, and thanks to those that are watching online. I hope you have found it informative and helpful. Thank you.
Thank you, Fiona.
Thanks, Angelica.
See you.
See you soon.